Hi everyone, Dr. Cary Yurkiw here. Thanks for joining me today for this webinar called Practice Growth, Innovative Marketing Strategies for Health Professionals. And we're going to talk about what you can do to get the word out about your practice, to grow your practice, especially if you're in the early phases where you don't have a lot of clients, maybe you're brand new, and you want to build up that critical mass. So the marketing problem in healthcare is a lack of time and staff help, inconsistent new patient flow because you're just getting started and nobody knows about you, or maybe you've been out for a while and you're just having trouble with growth, outdated marketing strategies, and then the cost versus return uncertainty. Basically, you don't know if it's worth it, and you're a little bit scared to spend some money on marketing or advertising, especially if you've been burned before. And marketing has changed a lot over the years. I mean, it's gone from print and TV and radio to more niche and specialized like social media, YouTube, those types of channels, even podcasts. So it requires a mindset shift. You have to systemize your growth, achieve sustainable and scalable business expansion. You want to test your methods, validating strategies through data-driven experiments, very important. I even like to split test and see if I can better my systems by testing a new strategy against the old strategy. Sometimes I'll dedicate 10% or up to 25% of my budget of the new strategy against the old strategy. And you want to be proactive, anticipate market trends, and act accordingly. The three pillars of modern practice marketing: conversions, that's the top, content in the middle, clarity on the bottom. So define your brand and your ideal patient. So you need to know who your avatar is, who is your ideal patient, and how are you going to communicate with them. Content-wise, you want to create educational and visual assets that appeal to that demographic or that target market. And then you want to convert. You want a funnel strategy to turn interest into action. So you want to have them click through, you want to have them read more, and then you want them to purchase, to basically book an appointment with you. How can you rank your clinic #1 locally? Well, reviews are very important. Social proof, encouraging and managing customer reviews. And then your Google business profile, optimizing your business profile for visibility. So you might call that SEO or maybe SEM, but you definitely want to use strategies that will rank your business high, because this is like free marketing using search engines. So here's a bunch of reviews that I've had in my clinic. We like to promote those. We like to ask people for reviews. We like to get video testimonials. We like to have an email we send out to people that are raving about our care, saying, could you post a review for us on Google, or even on something like RateMDs, because then that'll help some other people in our community with a similar type of problem, similar to yours.
Hi everyone, Dr. Cary Yurkiw here. I'm the chiropractor at Tud Street Family Chiropractic. This is room 1, where all the magic happens with laser and shockwave, which is on that card right there. We use laser and shockwave interchangeably for soft tissue and joint injuries, like rotator cuff, like plantar fasciitis in the foot, hip sprains, spinal injuries. And laser works with light therapy, a concentrated light beam, to stimulate the mitochondria and heal the tissue.
So here I am doing a video for social media. It's explaining the types of services we offer in the clinic, giving the person that's watching this a behind the scenes look at the equipment we have, the use of the equipment, why we use it. Very important to get the word out, to share that with other people. So I encourage you to do that, to keep it simple, to explain your procedures and your processes, why you do what you do, and that's going to connect with people that are suffering, people that are in pain, people that have health issues, they're going to connect with that and reach out to you for help. Patient retention and referral funnels are important. I like to do webinars like this on specific topics, and I'm just going to get rid of my picture there, like fix your foot, knee, and hip pain naturally. And this talks about how you can, how we can do that, how we can help you in the clinic with these types of health conditions, and what you can do to empower yourself and to help yourself to deal with these types of conditions. Now, we'll send this out in an email, and we like to do our email newsletters on a weekly basis, and keep it consistent. That's really important. Keep the same format. You might want to tweak it a bit, kind of like I talked about earlier, that split testing, and then you just want to make it easy for people to click on that button and to get a free ticket for this event. At the very least, it's showcasing the services that you have to offer in your clinic. So an email and newsletter can lead to some referrals. You can also use text to let people know, so to reach out to them. And then you can offer incentives. Check how your call to actions are working, like this free ticket, and you can vary them. You can mix them up a bit so that you can test it and see which ones work best for your clinic. Which paid ad strategy should you implement? Well, split testing like A/B, we talked about that. Email retargeting, especially with people who haven't been in a while, good idea. Keep them in your family, in your tribe. Make sure that you're in contact with them. Bring a friend campaign, so encouraging them to refer and bring others. You can do a reduced price initiative like this one. Quick wins with a small budget. You might want to boost the sales of some tickets for the event that we just talked about, and spend a very little amount of money kind of getting the word out in your community, getting more ticket sales. And things like free checkups for children. Great idea. It promotes health. It brings up a younger generation in your clinic. It also may work with benefits that people have for the children that they don't know about. Now, for systems and delegation, what I like to do is use tools like apps. Now, you want to make sure everybody's on board with these apps. One of our apps that we started using last year that's carried over to this year is Slack. It's been excellent. We use ChatGPT to help us with social media posts. We just started using Notion. I'll keep you updated on how that's going. We use Eventbrite for our events, Google for our searches and our to promote our ads, Canva for creation tools, messaging systems to communicate with patients, and Otter for recording our meetings and summarizing the staff meetings we have in the clinic. So all really wonderful apps and technology that can help you to do your job better. You also want to have checklists. I'm a big believer in that because you want to see your staff succeed. And one way to do that is just to give them a basic checklist that they can follow, like opening procedures, closing procedures. And then you want to give them checklists like weekly and monthly procedures, and include marketing in the weekly and monthly procedures, because they can keep an eye on what we talked about earlier in this webinar. Now, if you want to take some action on what we talked about today, then you can book a 15-minute strategy call with me, and we're offering this for a limited time. The best way to do that is just scan this QR code right here. When you do, it'll take you to our website. Just sign up with your name and email. We'll send you a link to set up the first call, which will be about 15 minutes. And we'll just talk strategy. We'll answer some of your questions for you. We'll discuss how we could help you to improve your practice and some of the things you can do to help yourself. You could also message us, sorry, that border keeps popping up, at 778-215-9310. You can call or message us there. I'd be happy to get back to you to set up a time directly so you can DM. And that way you'll get the help you need with your practice. So thank you so much for joining me today. If you have any questions, you can put them in the comments below. You can also type them in the chat or the DM us, and I'd be happy to get back to you to answer your questions.